to Good Morning Arkansas. Today we are talking about regaining our health for 2022. So from getting in shape to eating better, the new year is often filled with resolutions. But how can we make and stick to long-term changes to reach our weight loss goals and regain our health? So joining me today is Dr. Oscar Talledo with the Bariatric and Metabolic Institute at Arkansas Heart Hospital to speak more about this. Thank you so much for joining me, Dr. Talledo.
Thank you for having me.
Yeah, so if we want to lose weight and permanently, what surgical options does BMI offer to help us achieve that?
So in this institution, we offer two options, a laparoscopic sleeve gastrectomy and a laparoscopic gastric bypass. They're both great surgeries. They both achieve good weight loss, and they both help with a lot of obesity comorbidities. They have slight differences that it's our job to pick up the differences between our patients to kind of recommend one over the other in specific cases.
Well, to some people, getting surgery, it may seem really daunting. So tell us more about BMI's approach and how this aids the recovery process.
Well, the great thing about this institution that we do everything in-house. So in the same building, we have the pre-op workup, we have all our consulting teams, we have us, the surgeons, we do the surgeries right here on the first floor, and the patient stays with us in the second floor until he's ready or she is ready to go home. So I think that's a great approach. Also, after surgery, they come and visit us at a scheduled, very short-term lapse of time. They come back at 2 weeks, they come back at 6 weeks, 3 months, and so often. So we stay with our patients for forever. And if needed, we see them sooner than scheduled.
So besides weight loss, what benefits does bariatric surgery offer?
I think that the metabolic part of the bariatric surgery allows us to provide an improvement or complete resolution for some of the comorbidities of obesity, like hypertension, diabetes, obstructive sleep apnea, PCOS, hypercholesterolemia. So very often our patients go off of those medications the day after surgery. And some will achieve being off medications down the road, 3 to 6 months down the road.
How exactly does BMI help keep the weight off?
Well, it is known that with dieting and exercise alone, the people that achieve weight loss and to keep the weight off long-term is only in the single digits, like, less than 10% people will achieve that. With bariatric surgery, that number goes way up. And we have to understand that this is a metabolic disease. It is not brought upon the patient to himself. So this is the best option. This is the standard of care for obesity. With the surgery, we also help cement good habits in our patients' lives, meaning better diet and exercise. And we help with those two areas as well here in the same building with help of our dietitians and the rest of the team.
So how can someone find out whether they qualify to become a patient at BMI?
Well, if you have a body mass index over 35, you're already qualified for a bariatric surgery. And I wanted to add that the resolution of one of the biggest comorbidities, being diabetes, is around 70%. We also give more lifespan to our patients, and we improve the quality of their lives. There is an army of people that we have in the office that actually go through the patient's insurance so that we offload that responsibility from the patient, and we offload that responsibility from the patient's provider. So they just have to know, oh, this patient meets the criteria, which is a BMI over 35. They just make the referral, and we will take care of everything else.
Well, if somebody is interested in getting started or just learning more, where can they go to seek that information?
Well, they can go to our webpage, which is bmi.arheart.com, or they can call our office at 501-219-7770.
Great. Okay, Dr. Talledo, thank you so much for joining me today.
Oh, thank you.
We'll have more Good Morning Arkansas after the break.